All right, we are here at ASAPS 2019 in New Orleans, and I'm here with Dr. Michael Eisemann. And I think you have some exciting news to share with us, so take it away.
Well, first, I've been here for 3 days now. We're about ready to go home, and it's been a very interesting meeting. It started off with rhinoplasties and breast augmentation and breast lifts and total body contouring, and it's really a very comprehensive meeting.
Wow.
But as far as our office is concerned, our practice is a new addition. Will be my son who'll be joining us this year, actually in a couple of months.
Congratulations.
And thank you. And what he'll be contributing to is an area of plastic surgery which is very complex, actually. It involves cranial vault surgery and microsurgery. In fact, he's taking his fellowship at one of the few places in the United States where they do total facial replants. For people who have allograft transplantation for cadavers, where they actually use their face and transplant to a new face. So it's for people for burns, for example. That's typical for those people, which is really devastating. But it's a very interesting area in plastic surgery. I don't know how many cases he's going to be doing like that, but private practice. But he has an area that's very interesting. So we're happy that he's joining us.
That's awesome. How are you going to like working with him in the same office?
Well, we'll see. It's going to be maybe a challenge, but I think it'll work out. We've always got along, so it shouldn't be a problem.
Speaking of him, tell us about him as a kid. A little bit about his background.
He's told my wife and friends that he always wanted to be a plastic surgeon. He never told me that, but apparently he's had exposure. He's seen what I've done, what we do. He's rummaged through photo albums of before and after pictures of people I've operated on, so he knows what it's for about.
Yeah, you said it's a family business, or it's been in the family for a while, right?
Yeah, my father was a physician. He did a lot. He practiced medicine when they were doing everything. He was delivering babies and doing surgery and doing general surgery, and he had a full practice, very busy practice. I remember him growing up. We had no appointments. I remember we lived upstairs, and his office was downstairs, and in order to get downstairs, there were patients that were sitting on the stairs, and you couldn't really get downstairs without climbing over the patients waiting there. So you don't see that anymore.
Wow.
But,
yeah, that would not be...
It's very unusual. But anyway, he had a very, very, very diverse practice, and it's influenced me, and I think I've influenced him too. So it's kind of been fun.
That's great. That's really cool. Something to look forward to. So the timeline on it, a few months, he's going to be finishing his residency?
He's actually finished the residency.
Okay.
This is a fellowship that he's taking now, and it's been, I guess, about another 6 weeks.
Wow.
He'll be there. So it'll be, it's happening very quickly.
That's really exciting. Speaking of ASAPs, is there anything that you've been excited about here, technology-wise, anything you've learned that you're excited to bring back to the practice with your son?
I don't know. I think, as I said before, I think it's being very reaffirming. The whole meeting, and I think a lot of people come here to reaffirm that what they're doing is on par with what other people are doing. There are some new things. For example, the technology is always interesting. There are new various forms of energy, basically based procedures that involve lasers, radio frequency. Those are very common things. There are some devices, allograft devices that they're using, support scaffold devices for augmentation and breast lift procedures, which are new. But it's a remarkable, the technology. It's incredible.
Yeah, it's always getting better.
Yeah, it's amazing.
Thank you so much for taking time to share with us about your exciting news and about ASAPs.
Great.
Appreciate it. Thank you.